Needymeds users and friends, thanks for joining me. I'm Carla, the Director of Education. Excuse me, no, I have a new title now. I'm Carla, the Director of User Engagement at Needymeds. Welcome. And today I'm going to teach you how to find healthcare savings and educational resources on needymeds.org. Now, before we get started, I'd like to offer a few tips so you can make the most out of the presentation. First of all, you can ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know I'll reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you by email. I will provide my contact information and the contact information for Needymeds at the end. This webinar is being recorded and will be available on the Needymeds YouTube channel. And a copy of my PowerPoint slide deck and other handouts I thought you would be interested in can be found in the Handouts section of your control panel. With this presentation, I'm going to cover what Needymeds is, what healthcare savings resources are offered, including the Needymeds Drug Discount Card. Needymeds also offers educational and other resources, so I'll cover what those are, as well as easy ways to stay in touch and up to date on healthcare topics. So let's get started with what is Needymeds. Needymeds is a national nonprofit founded more than 2 decades ago by retired family physician Dr. Richard Sagel and Libby Overly, who was a medical social worker. Rich is still the Needymeds president. On the screen is our mission statement, a statement about how we achieve that mission, and our vision statement. But simply put, Needymeds connects people to programs that will help them afford their healthcare expenses. We do that free and anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. And one of the most popular and effective ways we do that is with our listing of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program, but when one is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare provider usually needs to be involved by providing a prescription, signing the application, and submitting documentation. So, how do you find prescription assistance programs and other healthcare savings resources on the Needymeds website? So bear with me while I transition out of the PowerPoint and onto our live site so I can demonstrate. As you can see, there's a ton of information on our website, so I encourage you to explore our site further when time allows. Now, if you're looking for a cost savings program for a medication, you can always begin your search for savings programs by typing the name of the drug into the drug search bar on the top left-hand side where my cursor is blinking, if you can see it. To specifically look for prescription assistance programs, click on that Patient Savings tab. I'm going to make the screen a little bit smaller now. Don't worry really yet about seeing the text. I just want you to see all those different categories pop up. Those are all the different categories and ways to save on your healthcare expenses. So let me make that a bit larger now. And you'll notice in the top left-hand side, the very first box is dedicated to saving on prescriptions. Now, to look for prescription assistance programs, you can search, again, on the top left-hand side, and you can search a number of ways. You can search by the company name, you can search by the program name, but most commonly, you can search by the brand name of the medication. That's a hyperlink. I'm going to go ahead and click on that. And when this page loads, the first thing that's going to pop up is a bunch of icons. Now, what these icons do is they let you know what type of information or cost savings program is available for that medication. For example, is there a savings program available, such as a prescription assistance program or coupon? Is there more? There's a coupon. That's the coupon icon. Or is there more information available about that drug through support pages, through a drug video, or through drugs.com. Now, right below that, you'll see a convenient A to Z index, and you'll find this in a couple of our sections under that patient savings tab, when the section is pretty big, we put this A to Z index to make your search easy. So let's say I'm looking for a cost savings program for a brand name drug called Eliquis. I'll go ahead and choose E in the A to Z index. And then once the alphabetized list of E medications pop up, I will scroll down to see if Eliquis is listed. Keep in mind, if a medication is listed more than once, click on all of the links so you don't miss any information available about the drug or cost savings program. So right there in the middle of that page, let me make the screen just a tad bigger. You will see Eliquis. I'll go ahead and click on that hyperlink, and there are those icons again. The ones on the right indicating that there's more information available about Eliquis through drugs.com, through drug videos, through support pages. And the two icons on the left indicate that there are cost savings program available for Eliquis. This icon indicates that there's a coupon, and the icon on the far left, the very first one, indicates that there is at least one prescription assistance program available. That's a hyperlink. I'll go ahead and click on that. And right at the top, you will see this blue bar. And within that, there's text that reads Program 1 of 2. And that means that there are currently 2 prescription assistance programs available for Eliquis. And the reason I say currently is because programs change all the time, and we do add programs regularly. So if you're looking for a cost savings program or prescription assistance program and you don't have luck finding one today, be sure to check back our website to see if we've added one at a later time. Now, again, I'm going to make this screen just a bit smaller. Don't worry about reading the text. I just want you to see what a snapshot of that prescription assistance program page looks like. And once we dive into that, I hope you'll agree that all of the pertinent information is right on your desktop now. So let's make that a little bit bigger. And so right at the top of these prescription assistance programs pages, and one thing I did want to mention that's really important. When there is more than one program, like there is in this case, we list them in orders of how much help they provide. For example, the programs that provide the most assistance will be listed at the top, and the lesser assistance will be listed at the bottom. Okay, so getting back to what's on your screen right now, at the top, you will always find the name of the supporting organization. And right beneath that, you'll find their contact information, which usually does include a telephone number and a toll-free one at that. That's important because if you have any questions about the program, you're going to want to make sure to call the program directly as opposed to Needymeds. Next is the application and form section, where you can usually find a link to the application itself, like here. In the rare instance when the application isn't there, you'll find more instructions on how to obtain one. Really importantly, each program always lists an eligibility requirements section. Now, as I said in the beginning, although eligibility requirements will vary from program to program, they're almost always based on 3 factors: insurance coverage, residency, and income. And income requirements are often based on a certain multiple of the federal poverty guidelines. And because that is so common, you can find a convenient federal poverty calculator right here. So keep that in mind. Moving along, the application section is also important because this will tell you important tips like if and how your doctor needs to be involved and how long it will take to find out if your application has been approved. The medication section will also let you know important information such as where the medication will be sent and the details for reapplying. Always check out the additional information section because that's where we put other important information that doesn't fall neatly into the other categories. Now, before we move completely on from prescription assistance programs, I will remind you that if you have questions, go ahead and type them into that questions section of your GoToWebinar control panel. I'm going to go ahead and return to that patient savings tab so we can talk about other cost savings programs you can find under there. Now, in the top left-hand box under that Save on Prescription section, I'd also like to point out our $4 generic discount drug program section. Now, as I said, the prescription assistance programs often offer cost savings programs for brand name medications. This $4 generic discount drug program will help you find cost savings programs for, you guessed it, generic meds. And as you can see on the screen, you can search for a program a number of ways. You can search to see if a specific drug is included. You can search if a specific pharmacy or your store in your area is participating in the $4 generic drug discount program. But you can also search geographically to see what's available in your state. So I'm just going to click on one of the states right at the top, Arizona, and the results yield that there are currently 4 stores or pharmacies in Arizona that do participate in the $4 generic drug discount program. And what this really does is it lets you know what stores or pharmacies offer generic medications for a discounted price. Now, although it's called the $4 generic discount drug program, most do range in price between $3 and up to $15 to $20 for a 30, 60, or 90-day supply. And as you can see, and hope you'll agree, all of the pertinent information is on your screen right now, like the store or pharmacy name and a hyperlink, if available, that is participating in the $4 discount drug program, the name of the program, and most importantly, on the far right column, the program column, you can read about exactly what savings that this program affords. So let's move on to another really popular destination on the Needymeds website, which is our free, low-cost, and sliding scale clinic section. And as you can see, we have broken down this clinics category into 4 major sections. You can find medical clinics, dental clinics, as well as mental health, and substance addiction clinics. Now, these are all set up the same way. So for the purposes of today's webinar, I'm going to demonstrate using medical clinics, but again, they're all set up the same way. Now, there are over 16,000 medical clinics in this section alone, and I believe in total, including the other clinics in this database, we have over 18,000 clinics nationwide. Now, medical clinics, I like to point out, because even if you do have a primary care physician that's affordable and convenient, the medical clinics may also be a good option for those that may find themselves in need of an alternative to an emergency room visit, for example. Now, because this category is so large, as I said, just the medical clinics category has over 16,000 clinics, it's a great suggestion, I think, that if you're looking for a clinic in your area, don't do a broad state search because there's so many. Start with a narrow zip code search. So let me show you what happens when I type in just a random zip code. So let's put that in, and we're doing the zip code 94974, and let's do 5 miles within that zip code. So there are 9 free low-cost or sliding scale clinics within this category. And all of the information that we think is important is now on your screen, including the name of the clinic, their address, contact information, and website, if one is available. The center section that reads eligibility will let you know who can be seen at the clinic and what fee, for example, can the patient expect to incur. And the far right-hand column, labeled details, lets you know what services does this clinic provide and when are they open. Now, although we pride ourselves on the information on our website being accurate and up to date, we always stress visiting the website or calling the clinic before you show up. And I think that's become even more incredibly important considering the pandemic. Now, a really helpful tool is, let's say you wanted to print out all of these 9 clinics, either to hang on to the list for yourself, share them with a loved one, a patient, or a client. Well, you can do that by choosing the print all option, and that will generate and print a list of all 9 clinics. But let's say, there's only 4 out of these 9 clinics, for example, your patient would be interested in. Well, on the left-hand side, above the link to a map, and the map link is exactly what it sounds like. It's a link of a map of where this clinic is located, in case you're not familiar with it. Anyway, you can choose the clinics you're interested in by simply clicking on that box on the top left-hand side. And then you would choose the print instead of the print all option. And that'll do just that. It will print a list of only the ones you chose. And that's great if you want to provide a more narrowed down list. Moving on, at the bottom of the left-hand column under that patient savings tab, you'll find the coupons, rebates, and more category. And this is where you can find prescriptions and over-the-counter medications or supplies for which there is a trial offer, a free sample, a coupon, a rebate, or a savings card. Now, you can search a number of ways. You can search in this category by the brand name of the drug. You can also search by the brand name of the category, the brand name of the product, but you can also search by category, which does mean medical category. And let me show you what that looks like. When I click on that hyperlink, there's a list of alphabetized medical conditions or diagnoses. So let me show you what that looks like. Let's say you, a loved one or a patient, is living with asthma. So you can go ahead and click on that asthma hyperlink. And one of the helpful things about this section on our website is there are those icons again. So like the prescription assistance program section, the coupons, rebates, and more section will not only list it if there's a coupon or rebate available, but it will also let you know, is there a prescription assistance program available? Can I get this medication through the $4 generic drug discount programs category? Or is there more information about this drug or product through support pages, drug videos, or through drugs.com? And here is a list of what the coupon section looks like. As you can see, the names of the drugs and products are alphabetized. There's a statement or two about what the offer is, and then a bullet-pointed list of pertinent information. You will also find a link to the manufacturer's offer, and right at the bottom, above all of those icons that let you know if there's another cost savings program or more information about this particular drug or product, you will find an easy way to obtain the Needymeds drug discount card. And we will talk about how the Needymeds drug discount card is another important cost savings resource for you. For now, let's move on to, I would say, the second greatest source of savings after prescription assistance programs, which is through our diagnosis-based assistance programs. So again, we're returning to that patient savings tab, and this time we're going right to the middle, and I'm clicking on the diagnosis-based assistance section. Now, like the other categories, you can search a number of ways. You can search really narrowly for a program by by disease or diagnosis state and the services that it provides. You can search probably by the least common program name. You can search geographically to see what's available, and you can also search by diagnosis. Now, let's talk about what these diagnosis-based assistance programs are. These programs provide financial assistance for costs associated with a particular diagnosis. Now, this section is different because for the most part, it excludes medicine. What it does include instead are other necessary medical expenses, things like medical supplies, medical equipment, or expenses like wigs, house cleaning services, or assistive technology. I like to use the example of searching for, as I said, for a diagnosis. And I'm going to go ahead and use the example of diabetes. And I use that because not only is it so commonly diagnosed in our country, but it's a great example of a diagnosis that really requires a lot of expense in addition to medication. Often diabetics need to purchase things like testing strips or needles or syringes. So I'll go ahead. It has that easy A to Z index because, again, this is a large section on our website. I'll go ahead and choose D for diabetes. And when that page loads, I'll scroll down to find diabetes. Now, because it's such a large category, it is broken up into a number of categories. So I'm just going to go ahead and choose the general hyperlink for diabetes. Now, right at the top, the results let me know that there are currently 87 diagnosis-based assistance programs for diabetes. The other information at the top we'll come back to in a second. For now, here is a snapshot, again, of what we feel is the most important information about these diagnosis-based assistance programs. On the left-hand side, you'll find the name of the program and a hyperlink if available. Next to that, you'll find a summary about the program. And the columns I think you'll be most interested in are the two on the far right, services provided and the areas of service. Now, the services provided through diagnosis-based assistance programs do vary greatly, as I mentioned a moment ago. As you can see here, some of these programs offer help with things like medical supplies and assistive technology, but you can also see they offer assistance with the patient getting respite care or maybe access to service animals. So it's really worth checking all of the services that you may be eligible for. Now, you may notice on the right-hand side under the areas of service, you keep seeing the word national. That's because we list all national programs first, which means regardless of where you live in our country, you are eligible to apply. And then underneath that, you will find all programs available in your state. And the states are listed alphabetically, as you probably guessed. Now, returning back to that patient savings tab, and let me make the screen a bit smaller. You'll also see that we have sections dedicated to medical transportation costs. Oh, but I'm jumping ahead. One thing I really want to point out, and you may have noticed this already, I hope you did, is in the center section, right under those diagnosis-based assistance programs, you will find our COVID-19 Resource Center. And this is a section newly created that helps people that are having trouble affording their healthcare expenses or having financial difficulty due to the pandemic. So please do check this out, and you could look for services geographically to see what's available in your state or nationwide, which I think is the easier search. But you may also be aware of a program, so you can search by program name. And please shoot me an email, and I'll give you my contact information at the end if you're aware of a program and we don't have it listed, because this section is growing every day. So now returning to that patient savings tab, moving on, I also wanted to point out we do have additional categories dedicated, for example, to medical transportation, as we recognize that getting to and from a doctor's office or a healthcare facility can often be financially burdensome. We also have retreats, camps, recreational programs, and educational scholarships for people living with specific diagnoses all over the country. And I'd also like to point out our government programs section. This includes state-sponsored programs and pretty exhaustive Medicare and Medicaid information. I also want to click on here because I additionally want to point out that in the prescription assistance program section, I said many of the eligibility requirements are based on a person's income, and that income is often based on a certain multiple of the federal poverty guidelines, and for that reason we have the convenient federal poverty calculator right there, but you can also find the federal poverty guidelines right here as well, and again, this is under the government section. Under that patient savings tab on the bottom right-hand side, as well as on the top left-hand side, you will find also a link to the Needymeds drug discount card. So let's go ahead and exit out of this out of this live website, so I can talk to you a little bit more about how you can use the Needymeds drug discount card to save on your healthcare expenses. So, our drug discount card, which offers those not using insurance a way to lower the price of their medication, can come in a few different forms. It can be plastic, like a credit card. It can be a paper version or a phone app. You simply take the Needymeds drug discount card to the pharmacy with your prescription and save. Now, I'm sure you know that there are other drug discount cards out there, but the Needymeds drug discount card is free and anonymous. We do not track your personal data, so confidentiality is guaranteed. There is no registration or no enrollment. There are no residency requirements, and the card does not need to be activated, and it is accepted in more than 65,000 pharmacies nationwide. The drug discount card can be used to save up to 80% on prescription meds. It can help you save on over-the-counter medications and supplies as long as they're written as prescriptions, and can even be used to save on human equivalent pet meds. You can also use the card to save 40% off medical equipment. So the big question is, who can use the card? Anyone. The only rule is it cannot be combined with insurance. So if you're uninsured, you can use the card anytime. And if you do have insurance, you may choose to use the card instead. And you may do that if, for example, your medication isn't covered under your insurance, you find yourself in a coverage gap, you have a high copay or high deductible, or maybe you've exceeded a cap for drug coverage for the year. So let's go ahead and return to the website so I can show you how to get your Needymeds drug discount card and some tools to maximize those savings. So as I had shown you before, right, when we transferred back to that PowerPoint, you can find a couple of links to the drug discount card under that patient savings tab, but you can also click on the Get Your Needymeds drug discount card box with the red arrow on the left-hand side, and they all take you right to this page. And here you can print out a downloadable PDF version of the drug discount card. You can download the app for free using Google Play or the iTunes App Store. You can request we mail you a plastic card by filling out this form. Don't forget to choose a design that you like. And you can mail us a self-addressed stamped envelope to the Needymeds P.O. Box. You can also, of course, reach out to our call center counselors at 1-800-503-6897. In case you didn't see me click on that, our helpline number is right at the top of our homepage, and our counselors are available weekdays 9 a.m. to 5 p.m. Eastern Time, and we do also have Spanish-speaking counselors. Returning to that drug discount card page, if you scroll to the bottom, you will also find a pharmacy search, and that's exactly what it sounds like. All you need to do is type in the zip code, for example, of where you live, and you will find pharmacies in your area that accept the Needymeds drug discount card. And right beneath that, you will find the drug pricing calculator. Now, the drug pricing calculator can be used so that you can find out how much the drug will cost you using the Needymeds drug discount card. The point with this page is that you can get your drug discount card, find out what pharmacies accept it, and know how much you're going to pay before you even head out the door. Again, if you don't have access to a website or the internet, or it's just more comfortable for you to speak to a live person, don't hesitate to reach out to our call center counselor. You can request that they drop a card in the mail for you, and they can let you know what pharmacies in your area accept the Needymeds drug discount card, and they can figure out using the drug pricing calculator how much that medication will cost you. They are here to help. So I'm going to go ahead and transfer once again out of this site back to the PowerPoint so I can point out a few other resources I hope you'll find helpful. Now, you can go directly to a website called findcare.org, type in a zip code, and find affordable clinics near your home. I also hope you check out safeneedledisposal.org, which is a site dedicated to safe disposal of home-generated used sharps or needles. We also host something called bemedwise.org, where you can find accurate, up-to-date, and useful information on the safe and appropriate use of medicines, safe storage of medicines, and the safe disposal of unused medicines. Now, for the past 35 years, bemedwise has hosted the annual Talk About Your Medicines Month. In October, which spotlights important healthcare issues, with the goal of better health outcomes through education and improved communication. 2020's Talk About Your Medicines Month theme is medication adherence. We've created a one-stop destination for everything you need to know about medication adherence on a website called talkaboutyourmedicines.org. Medication adherence is a crucial part of getting and staying healthy, so please check out talkaboutyourmedicines.org. Use the information and tools and share. Again, that's talkaboutyourmedicines.org. If you're interested in signing up for some of our upcoming webinars, you can do so on the bottom right of the Needymeds homepage on our calendar of events. I also promised you some easy ways to stay in touch. So on the top right of the Needymeds homepage, you will see a bunch of icons. You will find links to our Facebook and Twitter pages. Next to those, you'll find the YouTube icon. I suggest subscribing so you'll be notified when new content is added. You can also find us on LinkedIn. Next to that LinkedIn icon, you can find a link to our blog, the Needymeds Voice, where you can read timely, provocative pieces on healthcare-related topics. You can also follow us and share what we post on Pinterest and Instagram. Now, under that Advocates tab on needymeds.org, you will find our subscription services. Here you can order print materials such as our drug discount cards and brochures, and sign up for email alerts about program changes. You can also share and print many of our most popular brochures in electronic formats. And under that Advocates tab, you can also sign up for upcoming webinars. You can also find those upcoming webinars, as I said, on the bottom right-hand calendar events. You can also sign up for our monthly e-newsletter, Vitals, and learn about becoming a Needymeds Volunteer Ambassador. If you represent a group or organization, check out how Needymeds can create a customized drug discount card with your business's name and logo free of charge, or learn about other partnership opportunities. So with that, I want to get to some of those questions coming in, and I want to leave up contact information as promised. At the top, you'll see my colleague Alana's email address, alana@needymeds.org. If you're interested in ordering a bulk supply of drug discount cards and our most popular brochures, drop her an email. If you have any questions regarding this webinar or content I covered, you can reach out to me at carla@needymeds.org. And don't forget to visit our website, needymeds.org, and reach out to our toll-free helpline counselors at 1-800-503-6897. So let's go ahead and get to some of those questions coming in. The first one is, and this is a question we get quite a bit, how does Needymed support itself? Well, that's a great question. And to learn more about this, on our homepage, on the right-hand side at the very top, I believe it's right next to the call center link, you will find an About Us tab. And under there, you can learn more details about how Needymed supports itself. But for now, I will answer the question by saying we really rely on 6 major sources of financial support. We license fees for organizations' use of our databases. We sell a software called PAP Tracker that helps clinics simplify manually applying and tracking prescription assistance program applications. If you're interested in learning about that, shoot me a message in that questions section. We also do get a small transaction fee on every use of the free Needymeds drug discount card. We have thoroughly reviewed supporting partners on our website. We do accept fees from pharmaceutical companies for call center and application processing services. And the 6th one that I really did almost forget, but is super important, which because we are a nonprofit, we absolutely rely on corporate and individual donations as well as grants. Thanks for the question. So let's see, another question coming in. You mentioned you can use the drug discount card to save on pet meds. How? Thanks for that question. And actually, we did put together a less than 10-minute video on how to use the Needymeds drug discount card to save on pet meds. You can go to that Needymeds YouTube channel and type the word pets into the search bar, or you can email me and I'll be happy to send you the link. So I have a question coming in about how is the information on the programs collected and how often is it updated? So that's fantastic. That's a really important question. I'm glad it was asked. So Needymeds, the vast portion, and I would be lying to if I told you the exact percentage of staff, but an overwhelming portion of our staff is dedicated to researchers. So that means they are only charged with verifying and updating the program, the cost savings program, and other information we have on our website, as well as expanding those program sections by adding new ones. Depending on the category, the programs may be updated from every few weeks to every 3 months to twice a year. Again, it depends on the category on our website. One thing I do want to stress, and I really appreciate that question because it gives me an opportunity to say something really important. We consider our website users our partners. And what I mean by that is, first of all, we want you to be vocal about your experience on our website. Always work to improve, to make easier to search and make sure it's updated. So be vocal about your experience. But importantly, if you do find information that is inaccurate, or if you have information that we can add, please let us know. And you can do that simply by shooting me an email at Needymeds.org. You can also find more information under the About Us tab, including some of our staff profiles as well as our 990s in case you're interested in reading about that. Another question coming in, and I think I'll wrap it up with this one, which is, what time is the Needymeds call center open? So thanks for asking that. We are open from 9 a.m. to 5 p.m., but keep in mind we're located in Massachusetts, and that's East Coast time. And again, we do have Spanish-speaking counselors. So that's all the time we do have for questions today. If you did ask a question and I did not get a chance to answer it, I will follow up with you via email, or you can reach out to me, Carla at NeedyMeds.org, visit our website, or reach out to our call center counselors, again at 1-800-503-6897. We're all here to help. Thanks so much for your time. Have a happy, healthy, and safe rest of the day. Take care.